Dr. Drew Wallace here at Angelo Chiropractic and Acupuncture, and today we're going to talk about tools of the trade.
If your back's out of whack and you're feeling blue, you need to call Dr. Drew. He'll do his best to get you feeling great. Call 949-7878.
The most common tool of our trade is the hand. Chiropractic stands for done with the hand. So our greatest tool is our hands, both to touch, to feel what's going on in a person's spine, but also to manually adjust or reposition the spine. So the hands are the most common tool used, and probably the most, at times, probably most precise because of the touch and feel. Some other tools that I'm going to show you that we use for adjusting: the activator. Some people call it the staple gun. It sounds like a staple gun. What it does is it applies a small amount of pressure to the spine to actually help reposition and take stress off the spine in certain areas where we use it. This can be used on infants. It can be used on patients who have osteoporosis or thinning in their bones. It can be used for people who are just more sensitive to manual adjustments. So it's a tool that we use called an activator. There are other types of activators that we use. This is very similar to the other one. The other one is manually adjusted. This one is adjusted just through a touch point. So very similar to the other one, just a little different style. This tool is called the percussor, and it is an instrument similar to the activator in that it allows us to put pressure directly on the spine where we want it, and it uses actual fairly high pressure to change the position of the spine and to help relax the muscle. The table we've used different tables for different conditions, different body types, different even conditions that we're treating to treat different things. Most all the tables we have drop pieces on them. So what basically the pieces do is they elevate, they come up, we can adjust the amount of tension that we put on them. It's adjustable on the side, and as the person is laying down, we can apply pressure where we need it, and the table drops down. That terminal velocity is what allows us to move and change the position of the spine. We have here the flexion distraction table. It's called flexion distraction because it helps to flex and distract or move discs and joints within the back. This is a form of decompression treatment. Of course, we have the ability to change the height of it depending on the height of a patient. We can have the lower piece of the table move up and down. And while we're doing that, while the table is moving, I can apply pressure directly where I need to apply pressure to help stretch and decompress, particularly the lower back, hips, and pelvis. Now, this table also allows us to work with patients who may have curvatures in the spine. The table also allows us to change the position of the patient, moving the front part laterally, either left or right, which allows us to work on curvatures, scoliosis, things like that. The table allows us also to drop down the centerpiece just for comfort, for pregnancy, for women that are pregnant. They all have the adjustability to drop down in the center to allow them much more comfort. Well, now we're moving on to different tools of the trade that we use for different therapies, for different types of therapeutic modalities, we'd call them, to help with patients' treatment. May help with muscle conditions, may help with nerve conditions, may help with overuse syndromes, different things like that. This unit has both the ability to do electrical stimulation and the ability to do ultrasound through this small wand here. Now, electrical stimulation works to help relax muscles, help to sedate nerves, helps to calm areas down. Ultrasound is a form of deep heat. It's a thermal solution to help drive deep into tissue, to help break up adhesions, to help circulation, to even help relax muscles. We can use it in a constant format, which drives really deep and produces a lot more heat, or in a pulsed fashion, which many times can help pump edema or even swelling out of tissue. What we have here is a vibratory massage instrument, and it's used for deep vibration of the muscles, just to help relax muscles, to help break up congestion in tissue. We use this fairly often on a lot of patients, just for muscular relief, for pain relief. Now we're in the intersegmental traction table room, which a lot of people refer to this as the rolling table. We put patients on this to allow their spine to decompress and allow their disc to be hydrated. It's pretty comfortable, it's pretty relaxing. A lot of people like staying on this as long as they can. What we have here is kinesio tape. There are different copyrighted forms of this that are made. This one is TheraBand, and we use this to treat overuse injuries, muscle strains, to treat athletes many times, or even weekend athletes that may have overuse syndromes that we're trying to treat. There are some that we get that are already formatted specifically for specific conditions. This one's for posture, for people having problems with their mid-back, upper back, that we use. Well, I hope just a little bit of information here on the tools of the trade that we use here at Angelo Chiropractic and Acupuncture has helped you. If we can help you in any way, that's what we're here to do. We have almost 30 years of experience here. We provide compassionate and quality care. We provide patients really with what we think they need for natural therapeutic chiropractic and acupuncture care. You can reach us here at 325-949-7878, or you can look at us on the website, angelochiropractic.com. I'm Dr. Drew Wallace. God bless.
When your spine's out of line, call Dr. Drew. Therapeutic care, natural and true. Angelo Chiropractic, now don't you wait. Call 949-7878.